That's one of the first things that's going to date you today, and you see it.
That's right.
You see it out there.
Okay, what about you, Mr. Cosmetic Surgeon, that you can do anything?
Lift
me up.
I have to agree with Bill and Derek. I see so many women in consultation, and I just look at the way they wear their hair and what they're wearing on their skin, and that would do so much to make them look their target goals of young and healthy looking. I usually start talking about women taking care of their skin, avoiding the sun, physician-directed skincare products that make a difference. Even before you even consider cosmetic surgery, consider changing your hair, keeping it current, wearing good cosmetic that accentuates the advantages you were given by genetics and age. And then avoid the sun and get into some skincare programs, non-threatening programs that help your skin shine.
Okay, so if we were to go down the line right now, Bill, what is the thing in hair that most dates a woman then?
Right now would be a very stiff, over-coiffured helmet of hair. Hair that doesn't blow in the wind, hair that doesn't have a lightness and a freshness to it.
Okay.
To really get in there with the spray and the backcombing and the teasing to get that sort of, kind of thing going on. Just, it's the kiss of death.
And what about you, Derek?
Same with makeup. It's too much.
Too much.
And if you see bad makeup, you don't have to be a makeup expert, but when you see bad makeup out on the street, it's always too much. So if you look at sort of trend in makeup right now, it's seeing the skin. It's more transparency and accentuating your natural features rather than masking them.
You know, somebody once told me that when you were a teenager, which was many years ago, you would put on more makeup to look older.
Absolutely.
So less is more.
Absolutely.
And it's picking the right stuff.
Yeah.
And for you, Steve?
To me, it's unhealthy skin, dilated pores, spider veins, brown spots.
Not drinking enough water, that kind of thing, too?
It's really, unfortunately, you can't avoid it for many reasons, and there's many non-surgical reasons to bring out that beauty. Even if it's droopy, just healthy skin does a great job. And if the trend is toward less makeup, you need healthy skin because you can't camouflage it.
And so you want us to stay out in the sun. So that's why in the next segment, what we're going to talk about exfoliating and self-tanners. And we'll do that right after this. Thanks, guys. We'll be right back.
Natural by putting a second application through this area.
Okay, and just make sure you don't have that demarcation.
Yeah, you have to blend it down in the neck and into the hairline.
Okay, great, thank you. Well, what did you bring us today?
What I thought I would bring is, I start out with avoid the sun. Most people don't.
I know.
And I wish they would use tanners intelligently because they would just save the beauty of their skin. So they come in, they're rough textured, they're sun damaged, what do? There's in-office treatments like photofacials and crystal peels that will work, but you need to do something at home to maintain that improvement. And most physicians out there will understand what skincare prescriptions to fulfill. And I'll just give you an example of some of the things you can get nowadays. At night, when you're wasting 12 hours of your life sleeping...
I wish it were 12 hours, but...
That's over a week for you.
No, yeah, really.
What do? You can take some things like patches and take physician sort of prescribed doses of vitamin A, vitamin C, antioxidants, pro-collagen type substances, and just put them on your crow's feet, on your lip lines. And these stick through the night on your crow's feet. You can put them on the upper lip lines, those bleed lines where your eyeliner, your lip liner runs into.
Kind of bleeds in, yeah.
Fine forehead lines, fine transverse forehead lines. It works pretty well for those.
Well, with my breathe right, my mouth guard, I'll look really attractive at night.
Now, the thing about these patches are you want them to stay on. You don't want $5 to fall off onto the pillow and you can't find it or retrieve it.
Good point, good point.
So you want to make sure that your physician is aware of these products, how they work, and how they stick on your skin.
Okay.
They're quite successful.
So will I see the difference in the morning?
It's really, it's an approach and a program that requires coordination. So no, it takes about 6 weeks, which is how long it takes to turn over new collagen. And it's often coordinated with a couple of in-office treatments as well.
Okay, all right. And not cheap, but you have to check, everybody has a different price point on that?
Everyone has a different price point.
Okay.
But for this, you're usually talking about in the $50 to $60 range for a trial pack of 6. And looking your best is not inexpensive.
Okay.
And you can waste your time with over-the-counter exchanges if you don't have knowledgeable individuals like these two, or you can combine intelligent use of over-the-counter products and in-office physician treatments.
Yeah, there's so much out there, so you really have to research it. What else? What else?
Well, for cellulite, you're entering the spring and you've got some lumpy, bumpy cottage cheese.
Is that for another segment?
Well,
yeah, I don't do the lumpy, bumpy one right now? Because I was going to talk about being over 40 and getting cellulite out of nowhere. Okay, we'll save that for another segment. What we'll do is we'll take a break. We'll be right back. Why did I think it was there? The April issue of the Cityline Access magazine features a romantic bedroom makeover, ideas for loft decor, and upstairs storage ideas. Half haircut, no, but you're a good boy. And so are you, Bill.
Thanks.
Okay. Bill's a good boy, too. Now, can we talk about the cellulite? Okay, now let me talk to you about this. You know, we're, some of us baby boomers, you know, took on those aerobics classes and things like that to prevent all this from happening. But, you know, past 40, the cellulite starts pocketing every little place. And it really is kind of hereditary, isn't it?
Very much so.
Yeah.
People, they come into the clinic, they get a little confused, and we have to try and educate. There's fat and there's cellulite.
Okay, tell us the difference.
Fat is an unwanted collection of fat.
Right.
And you can grab it and squeeze it and hold it, and it's in areas you often don't want it.
Right.
And if you can do it through diet and exercise, that's what you should do.
Right.
And then liposuctions for those frustrating areas you can't get rid of. It's not a weight loss technique.
Okay.
So you leave that alone. Then from thin people to heavy people, you can have that lumpy, bumpy cottage cheese skin, and that is cellulite. It's very superficial.
Shows off in the back a little bit.
Back of the thighs and the bum are the first areas I see it.
a little bit in the front.
And then it starts creeping around the side, and then it's right up and down from the hip to the knee.
Yeah.
Very frustrating, and one of the most frustrating things we've had in cosmetic surgery, absolutely. Absolutely.
So, what can we do about it?
Well, what's available now? You can buy certain pills, and I wish they worked, and we've talked about these before. Yeah. I think it's good old-fashioned hard work, and in 2001, that's really what it is. There's in-office treatments where you get mobilized and squished and rolled. It's not surgery, it's non-surgical treatments, and it mobilizes the trapped metabolites in that lumpy, bumpy skin and smoothens it. The frustrating thing for women has been at the end of those in-office treatments, there's been nothing to maintain it at home. You got to keep coming back forever and ever. There are now a couple things out there that our clients enjoy and that do work and help maintain at home. I'm going to show you a couple of those. The first is called the Cellulite hose.
Now, did you put them on like Derek put on the self-tanners? Did you try them on? Or?
I think we would get into an X-rated show then. And
okay. Now, what do these do?
These are interesting. They're support hose. So support hose alone don't work, but they're impregnated with theophylline acetate in sort of a physician-prescribed type dose, and it's bound to the nylon of the fabric, and you get 16 of these over 6 to 8 weeks. And as you put them on, you wear 2 pairs a week, so 1 pair lasts about 3 days. You feel a tingling, and you get a slow timed release of this theophylline acetate over 8 hours. So you wear 8 hours a day. This is after an in-office treatment, remember, not on its own.
Right, not on its own. Okay.
So these are worn 16 pairs over the 6 to 8 weeks, and then you wear 1 pair a week on average after that.
When I have the, when I go to you and I have the treatment done, what does that entail? How much time?
It's about a 45-minute treatment, and depending on the clinic, this is the in-office treatments, sort of the bulldozer to get the sod into place, and then you decorate your garden.
Do you want to call it sod? I call it something else. Okay. So how long? 45 minutes?
It's about 45 minutes. Yeah. It's usually, depending on the clinic, it's about an 8-week program, and you're twice a week. And it could range anywhere from $1,500 to $3,000.
Wow. Okay.
Once you're on the home program now with your Cellulite hose, there's a maintenance mini version of this big device in the office. I'm going to turn this on, so stand back, everybody. It's done about 20 minutes a leg or a thigh, depending on how inundated with cellulite it is. And you do it 20 minutes each thigh, each night. And once you get the results you want, you do it probably every 3rd day.
So what this does is what?
Again, one of the problems with it's so strong, it even takes the cellulite out of the screen. Yeah. Cellulite is a complex metabolic problem in the skin. You need to mobilize the toxins, smooth the skin, and it, in combination with the theophylline, in combination with your in-office treatments, help mobilize that. And it's basically, it goes in 2 directions. It's going up and down, and it's going tangential to the skin. And you apply it to the thigh, and you move north. You mobilize all that fluid into your lymphatic system. Towards the heart,
and fade.
And fade, yes.
Doing a lot of fading today. Okay, so 20 minutes on each.
About 20 minutes on each side.
How do I get the back?
if you really have a loving spouse, yeah, you can get your spouse to put on the self-tanner on the face while you're doing this to your cellulite.
So your home spa.
The home
It's just
spa,
a home
yes,
spa, that's
home
right.
spa.
How much is that little machine?
This you buy at the end of your treatments. Again, depending on the clinic, it's about $500 investment, but it's yours for life.
Okay, well, so is the cellulite. So we go on to Julie now, and she's got a question for Steve. Go ahead, Julie.
Hi, yes, I was just wondering what Steve would recommend for somebody that has adult acne.
Yes.
What kind of skincare regime would you recommend? Because I know you were speaking of exfoliants.
Mm-hmm.
I use exfoliants, but my pores tend to continuously fill up, and you have a catch-22 situation where if you scrub too hard, you find you're damaging the skin. I don't agree with the peeling. They have some strips out, I won't mention the name, but they tend to give spider veins because they're pulling the skin too hard to try to cleanse the pores. I was wondering what kind of regime you would suggest for somebody with sensitive skin like that.
I think, Julie, it's a frustrating problem. Most acne-prone people do have sensitive skin, and then it is a catch-22. But you need to take care of the layers of your skin medically. You should probably consider seeing your family physician. If they're not comfortable, refer to a dermatologist who understands acne. If you're still breaking out, you need medical control of the acne, and there's topical antibiotics, oral antibiotics, there's Accutane and some newer products. Once you're not breaking out, you're going to be dealing with the damage. The damage is dilated pores and spider veins. And then you need to get into a combined program of crystal peels or microdermabrasion.
That's when that works. She's saying she's kind of...
Right, once she's under control.
Under control,
and under
right.
supervision, it's a combination of medical-grade exfoliating and combining treatments that take care of the spider veins and the redness that will ensue. So it's a combination approach. But only once a physician, dermatologist, plastic surgeon, or family physician gets control of your outbreaks. There's no point taking care of your skin if you're going to keep having outbreaks.
Julie, is she still up? Or, yeah. Julie, have you gone to a dermatologist?
Yes, I have, and it's not so much the acne that is flaring up as the pores keep filling up with debris. It's not so much a pustule acne, it's more like my pores are enlarged because of the acne and continuously fill up over and over no matter how much I cleanse the skin.
Okay.
Frustrating problem, and I think, Julie, like thousands of other acne sufferers out there, then if you're medically under control, seek one of the many physician-owned and directed aesthetic clinics out there that can deal with your pores and deal with the redness and deal with the spiders, because there's not much over the counter that's going to be able to do that, but there are wonderful treatments that exist now.
Okay, so do you live in the Toronto area, Julie? Is she
Yes.
still there? Okay. So maybe what we can do is take down your number, give you a couple of places you might want to go to, okay?
Okay, thank you.
You're very welcome. Thanks for calling. We're going to take a break. We'll be right back.
But no.
Okay. Vita's
Foil
on the phone
highlights.
for Steve. Thanks, Bill. Vita, go ahead. Hello, Vita.
Hi.
Go ahead. Steve is ready for your question.
Okay. I'm just wondering about under eye lines.
Yeah.
I'm starting to get them all over under my eyes.
You're talking about
I started noticing them like early 20s, and I'm
lines or
26 now, and it's getting even worse.
Okay.
Vita, are they dark circles or actual lines and wrinkles?
Just lines.
Okay, normally people will present with two problems, and often a combination. Dark circles, which is often hereditary. There are things that can be done, again, in a physician's office. And then lines. With lines can be character, and people like to have lots of character or little character. And then it's in-office treatment, see your physician, laser, topical drugs, or surgery.
Okay, and lots of options out there. We
Yeah.
appreciate your call. Okay, we all have had headaches at one time or another, probably from that cap when they put my color through my cap. So on our website this week, we focus on the symptoms and the warning signs. Really great information as always. Just go to citytv.com.
Lights in your hair, bit of color.
Clean out that cosmetic. When's the last time you cleaned out your cosmetic store?
That's a whole
huh?
other show.
Yeah, that's a whole other show. And really, if you really don't know anything about cosmetic surgery, it doesn't cost any money to book an appointment, does it? For at least a consultation, does it?
Absolutely.
Does it?
Yes,
Couple
it
bucks?
does. A couple bucks, yeah.
How much?
But you don't need surgery. Healthy skin. Healthy skin is important.
Okay, we're going to get the cost next time when he's on the show. So much for my consultation. Oh, that's right. The hairstylist does a free consultation. I forgot. All right, everybody. Have a great day. Thank you for watching City Line. How much is it? 50?